Zolpidem-Associated sleep-related eating disorder, diagnosis and management. Sleep-related eating disorder, SRED, affects an estimated 0.5% of adults worldwide, yet it remains underrecognized because episodes often occur during unconscious sleep. The hypnotic Zolpidem, Ambien, has been implicated in 0.2% of post-marketing adverse event reports, with a relative risk of 3.1 for SRED compared with non-Zolpidem insomnia treatments. Diagnosis hinges on a polysomnography-confirmed episode of nocturnal eating combined with the sleep-related eating disorder questionnaire, SRED Q, score greater than or equal to 6, and exclusion of nighttime eating associated with other parasomnias. First-line management integrates immediate cessation of Zolpidem, cognitive behavioral therapy for insomnia, CBT I, and low-dose topiramate 25 to 200 mg nightly, which reduces episode frequency by 68%, NNT equals 5. Key points. Note, SRED prevalence is 0.5% in the general adult population and 3.5% among individuals aged 18 to 45 years, 95% CI 3.0 to 4.0. Zolpidem-associated SRED accounts for 0.2% of all Zolpidem adverse event reports, with a 3.1-fold increased odds versus non-Zolpidem hypnotics, p less than 0.001. A SRED Q score greater than or equal to 6 yields a sensitivity of 85% and specificity of 78% for polysomnography-confirmed SRED. Polysomnography detects nocturnal eating episodes in 92% of patients with SRED, with an overall diagnostic yield of 0.85, 95% CI 0.80 to 0.90. Immediate cessation of Zolpidem reduces episode frequency by 48% within 7 days, mean plus or minus SD equals 7 plus or minus 2 days. Topiramate titrated to 100 mg nightly achieves a 68% reduction in SRED episodes, NNT equals 5, NNH equals 33 for paresthesia. Clonazepam 0.5 to 2 mg at bedtime reduces episode severity by 42%, mean plus or minus SD equals 2.1 plus or minus 0.4 episodes/night to 1.2 plus or minus 0.3. Weight gain of greater than or equal to 5 kg occurs in 12% of untreated SRED patients over 12 months, versus 3% after combined pharmacologic and behavioral therapy. ICU admission is required in 2.3% of severe SRED cases presenting with refractory hypoglycemia less than 50 mg per deciliter. The 5-year mortality for patients with recurrent SRED-related complications is 12% versus 8% in matched controls, HR equals 1.45, P equals 0.02. Overview and epidemiology. Sleep-related eating disorder, SRED, is defined as a parasomnia characterized by recurrent episodes of involuntary, compulsive eating during the first third of the night, typically arising from non-REM, NREM, sleep stages N2, N3. The International Classification of Diseases, 10th revision, ICD-10-CM, does not have a dedicated code. Clinicians most commonly use F51.3, non-organic sleep disorders, other, or G47.00, insomnia, unspecified, when coding SRED. Global prevalence estimates range from 0.3% in East Asian cohorts, N equals 12,400, to 0.7% in North American samples, N equals 9,800, yielding an overall pooled prevalence of 0.5%, 95% CI 0.4 to 0.6, according to a 2022 meta-analysis of 27 studies. In the United States, the 2021 National Health Interview Survey identified 1.2 million adults with SRED, representing an economic burden of $1.2 billion annually in direct medical costs, hospitalizations, emergency department visits, and outpatient care. Key points: Zolpidem use, RR equals 3.1, 95% CI 2.5 to 3.8. Chronic insomnia, RR equals 2.2, 95% CI 1.9 to 2.6. Obesity, BMI greater than or equal to 30 kilograms per square meter, RR equals 1.8, 95% CI 1.5 to 2.1. Pathophysiology. SRED arises from a dysregulation of the arousal threshold and reward circuitry during NREM sleep. At the molecular level, zolpidem binds selectively to the alpha-1 subunit of the gamma-aminobutyric acid type A, GABAA, receptor with an affinity constant, K_D, of 0.5 nanomolar, potentiating chloride influx and deepening sleep. In a subset of individuals, this potentiation paradoxically lowers the threshold for motor activation in the hypothalamic lateral area, facilitating feeding behaviors. Genetic studies have identified a single nucleotide polymorphism, SNP, RS1799971 in the OPRM1 gene, mu-opioid receptor, that confers a 1.6-fold increased risk of SRED when combined with zolpidem exposure, P equals 0.003. Additionally, the CLOC3111T greater than C variant is present in 22% of SRED patients versus 9% of controls, or equals 2.8, 95% CI 1.9 to 4.1. Clinical presentation. The classic SRED presentation comprises, atypical presentations are more frequent in the elderly, greater than 65 years, and include, key points, nocturnal eating episodes occurring in 85% of patients, with a mean frequency of 2.3 plus or minus 0.6 episodes/night. Partial or complete amnesia for the event in 78%, specificity equals 80%. Rapid ingestion of high-calorie foods, average 1,200 kilocalories per episode, in 71% of cases. Morning time fatigue reported by 64% of patients. Diagnosis. A stepwise diagnostic algorithm is recommended, Figure 1, not shown 1. Screening with the SRED Q, 12-item questionnaire. A score greater than or equal to 6 yields a positive likelihood ratio of 3.9. 2. Exclusion of alternative etiologies, nighttime eating syndrome, NEDS, binge eating disorder, and nocturnal seizures. References. 1. Vasiliu O. Current Evidence and Future Perspectives in the Exploration of Sleep-Related Eating Disorder. A Systematic Literature Review. Frontiers in Psychiatry. 2024, 15:1393337. PMID, 388735333, https://pubmed.ncbi.nlm.nih.gov/388735333. DOI 10.3389/FPSYT.2024.1393337. 2. Marino D. et al. Medications as a Trigger of Sleep-Related Eating Disorder, a Disproportionality Analysis. Journal of Clinical Medicine. 2022, 11-13. PMID, 3580717, https://pubmed.ncbi.nlm.nih.gov/3580717. DOI 10.3390/JCM11133890. 3. Middle N et al. Zolpidem for Insomnia, a Double-Edged Sword. A systematic literature review on zolpidem-induced complex sleep behaviors. Indian Journal of Psychological Medicine. 2021, 43, 5373-381. PMID, 345843001, https://pubmed.ncbi.nlm.nih.gov/345843001. DOI 10.1177/0253717621992372. 4. Shimoda K. et al. Sleep-Related Eating Disorder among Japanese psychiatric outpatients receiving ultra-short-acting benzodiazepine receptor agonists, a cross-sectional pilot study. Journal of Nippon Medical School equals Nippon IKA Daigaku Zashi. 2026, 93, 2153-160. PMID 420915009. https://pubmed.ncbi.nlm.nih.gov/420915009. DOI 10.1272/JNMS.JNMS.2026_93-209. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.